And a healthy life is a wealthy life. It's some kind of a privilege that a lot of you don't understand. You see, you get sick for 1 week. You know how much you pray to get. Well, you get sick for 2 days, and you're like, you're a changed person. You're just praying that God will give you back your health. When you have that, it means everything. And when we have it, we take it for granted. Don't be one of those people who made all the money and are using all the money to pay bills. When you bring it, we'll take it because we're here to take care of you. But you have to find a way to take care of yourself and pay attention to your health. This is Health and Life with Dr. Daly. My name is Dr. Ann Sansa Daly. Welcome back to the show. So today we're going to be talking about tumors and causes. And I have here with me Dr. Omane Echamfu, who's been here before, and he's back here. Welcome back, Doc.
Thank you.
And then I have Dr. Thomas Ankama. This is his second time on being here with us. We hope to see you one more time, at least. Anyway, so we're just going to go straight ahead with this. This is another broad subject, and I know we don't have enough time to cover it all, so we try as much as we can to break it down to fit the time that we have as possible as we can. So today we're talking about tumors. Can you explain to our viewers what a tumor is?
Okay, so tumors, as you rightly said, just essentially means, so let me use another word. Okay. And I'll explain that word and I'll come to tumors. Sure. So tumors just means growth, or like growth of like growth. Mm-hmm. Then we have another word that we call neoplasia. Mm-hmm. So neo means new, and plasia means also growth. Okay. Now, the human body, or every human being, is an aggregate of cells. Okay. That essentially makes up tissues, that makes up organs and organ systems, etc. Now, some of these cells are constantly in cycles of growth. Also, every cell is in a cycle of growth. Yeah. We have normal growth patterns, and then we have abnormal growth patterns. Okay. So when these growth patterns become abnormal, we can begin to describe them with some of these terms. So for the early, or for starters, I'll say tumors just means growth. But as we go further down the line, we'll realize that there are some growth patterns. For example, we would call some benign and some malignant. Benign just means it's a growth, all right, but it's not something to be worried about, like scared about. Yeah. And then there are malignant ones, which might be a bit scary. Yeah. So essentially, that's how I'll define it for now. Probably as we go on the conversation.
We're going to break that down. Yeah. So, what causes? This is to you, Dr. Thomas. What causes tumors, like growth? What causes some of these abnormal growth?
As Dr. Omane rightly said, tumors or cancers, as he rightly explained, it's just an abnormal growth of cells, or rapidly dividing, growth of cells. Okay. Generally what happens is every cell ought to grow, but in some instances, instead of the normal growth pattern, there's an instruction from the cells that this cell should grow into an eye or any part of the body, let's say the muscle. But in some instances, there is also an instruction that tells the cell when to stop growing. Correct. So with cancers, that interplay is a bit messed up. Okay. So the cell sort of doesn't stop growth, just continue rapidly growing or dividing and forms a swelling or a tumor. Generally it is difficult to pinpoint a cause. I think there have been several researches, but there have not been any clear cause to cancers. But there are risk factors that have been identified. Generally, I think that the commonest in play here is what we call genetic predisposition, or hereditary, let me put it that way,
Yeah,
because the human body is made up of genes. So genes is what tells us, I mean, basically we all came from a certain, you know, generation or genealogy or genes. So let's say we take our genes from our parents, maybe mother, father, then we also pass it on. So there are certain traits that is sort of transmitted along that generation.
Okay.
So that is what we mean by hereditary. So if there is some familial history or someone in your family had a certain cancer, the likelihood that those down the chain or in that chain of the clan could also develop. So we don't really have a cause, but generally there is hereditary, what you call genetic component. Yeah. And there are other environmental factors that have been linked to cancers as well. Okay. Maybe as we go on, we would
get into the
details.
So the other question is, I know there are different types of tumors. Now, what are the types, and when do you know if it's being invasive? When do you know it's actually going to? I don't want to use too many med terms because.
So let me help you, but let me backtrack a bit. So you have seen a muscular person before.
Yes.
Yes, like those with ripped
builds that way.
Excellent. I think that's a great way to understand tumors. Now, everybody's body goes through some stress at a point in time. So like, for example, let's say I go to the gym, I'm not so ripped or built up, and I put this pressure on my muscles. Now, because of the stress on those cells, with time they would expand. So that's sort of a regulated growth. Okay. So imagine like after that, you know, I stopped going to the gym, but the muscles keep growing. I'm not lifting any weight and it's growing. Then that's a problem. So we do have some adaptations based on the stresses that we go through, and the cells try and compensate. But when that becomes, you know, overboard, then that's a problem. Now we have two. So like I began to say, we have two basic ways of looking at growth. Whether it's so based on the clinical course. Okay, whether it's benign means it's not so harmful. Okay, you can have a growth like a fibroid. It's a fibroid tumor, but it won't necessarily lead to serious complications.
Which means it's like harmless.
It's not really harmless. Okay. Because you could bleed from a fibroid tumor. You could have miscarriages from a fibroid tumor. You could have atonia of the uterus, as in the uterus failing to contract from a fibroid tumor. But it's not as dangerous as you have in a cancer of the uterus itself. Okay. So the origin of the word cancer is the word crab. It means the cancer eats you away. Correct. Okay. So benign means it's not that dangerous. It's like a pistol. It's like you're comparing a handgun to like an atomic bomb. Okay. A handgun can kill you, but it won't kill you at the rate of Hiroshima and Nagasaki. I don't know if you get what I mean. Yeah. So benign malignant means it's cancerous. Okay. And then you would have classification, or we looking at it in terms of what cell is involved. Okay. Every cell in the body has a type. I mean, generally, if you're a science person, you might say all cells are cells. Probably for the arts people, it's a bit more simpler. But once you enter into the scientific community, we have to look at, is it an epithelial cell? For example, the cell that layers my lips are very different from the ones that probably make up my skin or make up my hair. Correct. So we look at them, it's an epithelial cell. Is it a mesenchymal? Mesenchymal means is it a tissue cell? Then we look at some cancers are mixed, so they have all types of cells within them. Okay. Then we look at how differentiated is the cell. So there's a saying that if you stay close to a tree, you might lose sight of the forest. Okay. So when we take any new growth, we want to look at how closely the cells of that new growth resemble normal cell or resemble normal activity. Okay. Almost like if you give birth to a child, the father will want to ask how the resemblance. How does a child resemble me? How does it might be that the child is not his child. So that's how we look at, or that's a basic way we look at. Okay.
So let's go back to the benign and malignant here.
Sure thing.
Now, when you mentioned benign, you said it's not that harmful.
Not that harmful, yes.
if it's not that harmful, how can it lead to other things? It means it may seem like that. Right now, you've changed my perception about benign.
Yes.
Because I'd say benign is, it's really not going to grow anymore and it's not going to hurt you.
Okay.
But it being there can actually cause, it can lead to something else.
Yes.
So we did mention
fibroid tumor.
Yes, fibroid. Good. So now, if it's benign,
yes,
and it can still harm you,
yes,
at what point do you have to get rid of it?
So the first step is, for most people, anytime they see anything abnormal, the anxiety. So the WHO definition of health is not just the absence of disease, but anything that disturbs your psychological well-being. So anxiety, worry, depression in itself can necessitate medical attention to that new growth. For example, you can have these collection of fat cells in your skin, we call them lipomas, or these ganglions that arise over the sheets. Yes, they are not necessarily harmful, but sometimes based on how they grow, they can invade certain structures and then bring problems. Then you'll have also, for example, we have breast lumps that we call fibroadenomas or breast mouses. Now, they are typically benign. You can leave them in the breast, for a long time without attending to them. But they have a 0.3% malignant potential, which means that if you leave them for a long time, 0.3% of the time, they will become cancerous. Now, 97 or 99.7% of the time, you can go away with it. But who knows? Probably you are that 0.3%. you get what we mean. So sometimes it looks benign, but who knows? Maybe you are the one to add to the statistic. And like you said, it's very difficult to tell who would be part of the statistic and who would not. Especially most of these things are spontaneous. In today's developed world, we are exposed to more cancer-generating things than our forefathers. We are eating more microwave food. We are eating more processed food. We are eating more processed meat. We are exposed to more sunlight. We are exposed to. We are using mobile phones. There are so much radiation around us. So you realize that worldwide there's an increase in cancers. Yes, because we are living in very different times.
So tumors are tumors and cancers are cancers.
So tumors can be benign or malignant.
Correct.
A malignant tumor is what we call
cancerous.
cancer.
Yes, tumors. All right. So let's talk of the genetic causes and the effect. So when is a tumor considered a genetic? I mean, we say genetically affecting you as an individual. The fact that my mother had cancer doesn't mean that my tumor is going to be malignant. So this is where that question comes in. When is a cancerous tumor considered genetic?
As you rightly said, I mean, if there is some hereditary component, so maybe a relative, an older generation,
which is what I was trying to avoid. That's why I said my mother probably had it, and I have a tumor, but right now it's considered malignant. Benign, because it's not growing, it's not going anywhere. At what point do I tell myself I need to go get rid of it before it gets to that level?
I think as a principle, I mean, fine, there can be some symptomatologies to certain kind of tumors or cancers, if I should. If generally most cancers or some tumors may even be asymptomatic, it may not show any symptom at all. But if there is a present symptom that is definitely disturbing to you, then there is the essence of, getting help.
So it means I have to wait till I get.
Probably, I don't know whether you remember this actress, Angela Jolie.
Yes.
Yes, she's taking off her breast and the ovaries. Yes, so her mom had breast cancer, and then through that she discovered that she had this gene. It's called the BRCA1 gene. Now, if that gene is in your family, it means you have a 50% chance of a lifetime risk of having either breast cancer or ovarian cancer. So it's 50-50.
So to be on the safer side.
So to be on the safer side. So some people, they do the genetic screen in their families.
Correct.
They tell which cancers am I likely to get, and they take off those organs.
Gotcha.
I mean, they develop forward. Here it's a bit difficult. And because I remember there was a family that had colon cancer. And so that means we have to take out all your colon.
Doesn't really make sense.
Yes, and that's a very big decision.
It is.
Yes, but that also means that you are less likely to have colon cancer.
Correct.
Because the more you leave it there, the more. So I think there were like 5 or 6. 3 had died from colon cancer.
Wow.
Then the rest of the 2 or 3 left. 2 were told that they should have the same.
Because it could be next.
They delayed. They had it.
Yeah.
They all died.
Oh boy, it means I'm next in line to die.
No.
Okay.
No, I think it's very, very true, because most probably those who are a bit medically inclined, may tend to overly remove some of these tumors.
Correct.
I mean, we know of the great neurosurgeon Ben Carson. I mean, had a familial history of prostate cancer,
Correct.
so took his prostate. And we also know of Pele, had a similar incident and whatnot. So if you are well versed, I mean, if ideally in our environment, maybe genetic testing may not be a very common practice here, because because of access and cost and things like that. But if you have access to these facilities, I mean, you can do genetic testing or tracing, just like we do for sickle cell and whatnot, and you can trace. And if you're able to identify that particular gene, then you can at least know then you would probably know how to probably fine-tune your treatment or how to prevent it if you have to modify the risk factors, especially the environmental factors, because with the genetic predisposition, there's really nothing much you can do unless they are doing some of these molecular treatments, genetic modeling.
All right, so we are going to be talking about some lifestyle changes that could actually create or get us to that point where tumors have to, start growing in places they're not supposed to. But before we do that, we're going to take a short break. When we get back, we'll continue. We could talk about this all day, but we don't have so much time for that right now. So I'm going to go ahead and take your submission on this whole tumor, and then we can take it from there.
Okay. So I think that if I was to speak to anybody watching us, any viewer, I'd say that your body is yours. I mean, you know what's normal, you know what's abnormal. But constantly checking your body will help you to recognize when something goes off. And as soon as something doesn't feel right, it doesn't look right, the onus is on you. The responsibility is yours to visit a doctor and to report that change to a doctor. And the doctor can pick it up from there and tell you whether, this is benign, it's not necessarily harmful, or this is malignant. We have to attend to it as soon as possible. And then with your diet, your diet is essentially your health. Cut down on the alcohol, cut down on cigarettes, preferably stop them altogether, and more fruits, more vegetables, and let's stay healthy. Thank you.
Dr. Nkrumah, you have something to add?
Okay, as rightly said, tumors and cancers are one of the leading causes of death or mortality in our world now. Modernization has changed a lot of things. Our lifestyle, how we do or how we see things. So if you have any of these predispositions, whether a familial history or genetic history, or based on your occupation or where you find yourself, it is important to be interested in what happens to your body. And if you're not convinced about anything, or should you be worried about any changes in your body, then rightfully get to see a healthcare professional to sort things out.
Thank you so much for being here. I really appreciate having you here for the second time, both of you. And I'm hoping to have you here more, actually, because we have so much to talk about.
It's a pleasure.
Sure. It's a pleasure.
All right, people. So, like we just said, and the whole purpose of this show is to educate. We're all learning. I've learned a whole lot today. I could break it down, but I don't have the time for that. And you know what I'm going to talk about, right? Okay. So a good life, a healthy life is a wealthy life. It's some kind of a privilege that a lot of you don't understand. You see, you get sick for 1 week. You know how much you pray to get... Well, you get sick for 2 days and you're like, you're a changed person. You're just praying that God will give you back your health. When you have that, it means everything. And when we have it, we take it for granted. Don't be one of those people who made all the money and are using all the money to pay bills. When you bring it, we'll take it because we're here to take care of you. But you have to find a way to take care of yourself and pay attention to your health. This is Health and Life with Dr. Daly. My name is Dr. Ann Sansa Daly. We'll see you again next week.
Start today, you get health tips with Dr. Daly. Yeah, giving you all the health benefits you need for your better life. Watch this show, Health and Life with Dr. Daly. 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 Health and Life.